Hi, everybody. This is week 2 of CHCMHS001. Week 1, we did an overview around what is mental health and how is that historically in Australia, and the changes and how that might impact our clients. Tonight, we are going to be doing some of the practitioner skills around the 3 clients. We have Jacinta, Tony and Ariana for this unit. So I'd just like to go over our slides because next week we are going to be fully doing practitioner skills. We did 5 tonight and you'll get that in your part 2 recording. But then next week we're going to be doing more. And if you are watching this recording and you are ready, you are very welcome to be able to come into class. Just send an email, contact our learner support officers, their email's just behind me there, and let them know that you would like to be booking in class. Make sure you've got your class link, and we can do 5 in our 3-hour class, but if we'll definitely try and fit in more if we can and help you. So in the recording, you will see people do one of their role plays, but we have portions of each of the clients so that you get an opportunity to see Jacinta, Tony and Ariana, which is a good overview, and a couple of them you get to see done twice. So it gives you an opportunity to see same scenario, different approaches, just to help you have a really good understanding around connection and engagement and respect and trauma-informed care as well. So let me share with you my screen and I'll go through the final parts of the slides for you, which you will have a copy in your own portal as well. And if you don't, then please reach out and let us know so that we can make sure that you've got everything that you need to be able to complete this unit. Okay. So open that up for us. Wonderful. So this unit work with people with mental health issues, and everyone has a mental health. Some people find that during certain situations that they may not be able to process that, or they're struggling and they'll come to you as their caseworker. So we're working with 3 young people in our role play scenario. So before we commence, in the spirit of reconciliation, Hayter Institute of Education acknowledges the traditional custodians of country throughout Australia and their connection to land, sea and community. We recognise Aboriginal and Torres Strait Islander people as the first inhabitants of this nation and the traditional custodians of the land on which we work, live and study. We express our gratitude for the sharing of this land, our sorrow for the personal, spiritual and cultural costs of that sharing, and hope that we may move forward together in harmony and in the spirit of healing. We pay our respect to all First Nation people and acknowledge elders past, present and emerging, and extend this acknowledgement out to any of our Hayter learners that may be watching this recording. I'm coming to you from Tarragoland, Bundaland in Queensland. A little bit of housekeeping, even though I know you're watching this in a recording, we do this when we're in classes. We have a Zoom etiquette in classes where we try and have microphones off because we are recording, and then to put our hand up if we want to do a segue, and you'll see people do that in our live recording that we've got following this one. There can be some content that is triggering. And so if one of the role play scenarios is a story that is close to you or brings something up for you, just make sure that you pause and step away. If you feel that you're ever stuck, then reach out to Beyond Blue or YB Blue or 13, 11, 14, Lifeline, who are very used to working with students who are struggling with time management, feeling a little bit overwhelmed, and also if they haven't studied for some time, they are very used to that. So please reach out if ever anything triggers for you or brings up something there that you're not quite sure what to do with. Otherwise, we create a very safe environment for our role plays. It's supported, and we have healthy professional boundaries in our class experience. So I wanted to run over session 3 because next week will be fully in role plays, and we've already got the recording for this, which covers session 1 and 2 as well. So just our respectful relationships that determine mental health needs. So the types of mental illnesses have some research and background around that. You won't be diagnosing, but you do have to understand, because it may be something that could help someone where it's like, well, we hear that often, so that someone feels like, oh, so I'm not the only one as well. So gather and interpret your information, do some research, have a strength-based approach, and determine the needs of your client. Empowerment and recovery, and provide support to facilitate recovery and responding to a mental health crisis, which might mean some tools that we would apply. So when we're working in facilitating recovery, that means that we may take the lead, not about what are the solutions, but coming up with options and strategies and working closely with our client. So mental health issues often given names to put people into different groups. It's not to stigmatise people or put a label, but it does provide an understanding around different types of mental health conditions. So bipolar disorder, historically, in the research report is about the history, was referred to as manic depressive, whereas now bipolar, which is about trying to help our clients find that regulated space when we're working in a non-clinical setting. So they may have medication prescribed, or they may need to have blood tests to make sure that there is an imbalance where their medication isn't actually as effective as what it could be. But the goal is to not let the highs too high or the lows be too low. So with depression comes anxiety. So depression lives in the past and anxiety lives in the future thoughts of our clients. Eating disorders or body dysmorphia as well. So it's a diagnosis, someone who has unhealthy thoughts, feelings, and behavior around food and their body shape. Obsessive compulsive disorder is someone who experiences thoughts that are obsessive and ruminate in their mind, just round and around, and not unable to let that go. And compulsive behaviors, whereas they act rather than process. So personality disorders are often very hard to diagnose. So if someone has APD, then some aspects might affect them in ways which is very difficult to cope with, just their day-to-day living skills. And so a client may present with an issue that they're struggling with, but there can oftentimes be an underlying disorder there or an illness that sits around that, which impacts or compounds on that as well. Post-traumatic stress disorder, now often referred to in our sector as PTSI, post-traumatic stress injury, because it can be worked through. It can take a very long time, but we see that as a psychological injury, not a disorder. It's about the body's inability to process and the mind's inability to process a traumatic event. So it's after the event, and yet it's something that easily triggered, unable to be able to work their way through. Recovery through that is possible, but it requires clinical support and support from you as well. So there can be psychosis. It can be impacted or induced by certain events, or it could be with a substance as well. Schizophrenia, given to people who experience the symptoms of psychosis alongside what are called negative symptoms. So read more about that. I'm based in Queensland, so I would go to Queensland Alliance of Mental Health, so QAMH is where I would go. But there's a lot of other very good, reliable, credible, evidence-based resources, and that's for you to be able to do your research around. Just make sure that you cite where you got your information and put that information underneath your research report as well. Anxiety and panic attacks. So it is normal to feel anxious. I hear a lot of people say I really struggle with the anxiety that I feel around a role play. It can be a normal emotional response to things that are stressful. It's only if it is a persistent one. And so it's when someone's feeling this way almost of the time, rather than a particular thing that they are anxious about. So it's about building resilience and agility. So our activity is going to be working through some practitioner skills. So the most powerful thing that you can say to a person with an invisible illness is, I believe you. So acknowledge what is happening for our client, that is hard, and then make sure that you're accessible to them in a calm and compassionate way. So I'll close off with our slides. We'll be moving into part 2, which will be bedding down our practitioner skills. Stop sharing that for you there. I did want to take us over just briefly in this recording, just to be able to show some of the resources that we're going to be utilising with this as well. That you can see that. Sorry. Just pop out of our downloads and open up that screen a little bit more for us as well. So here we have task 2 of 3. So the T2 up the top here refers to the task. So that's an assessment task for you. And 2 means it's the second one. The first one, task 1, is a quiz. T2 is this research report. And then T3 is the role plays, which we're going to demonstrate for you in our second recording for tonight. And then, of course, next week is all practitioner skills. And we make sure that we have our first 30 minutes, which is Q&A, which is about helping you with your assessment. And you can ask questions about anything that you're studying with your diploma reviews work. So for this, you're required to conduct research using both online and offline resources. Offline resources include your learner's guide. It might be some books, accessing some brochures and that from mental health sector and industry. Usually your local hospital or your GP clinic will have things like that for you as well. I know that I like to go into Headspace fairly regularly and go and pull some brochures from their office and make sure I give them to our clients. But our clients in our program will also be shared clients in the Headspace program as well. So you'll find you'll work very collaboratively with other agencies as well. So it's actually talking to you about your word count as well. So between 700 and 1200, it's got in allocated spaces, and it'll give you that as well. I do recommend that you copy and paste your questions and do your report on a Word document, just so that you don't lose any of that work. Just continually save that, and then you can copy and paste it and put it into each of the questions as they come up. So let me just walk you through. So question 2, and there are 8 questions altogether. The first we ask of you is, what's the historical context of mental health work? And it's asking you to do 2 things: discuss the history and approach of mental health care in Australia. The history, go back to the 1700s and then work your way forward. The 1800s became very interesting, where asylums were established. And then as we started to know more, then we applied health professionals in that space rather than seeing it as a detention. There's a lot of shame around mental health as a flaw. And so that member of the family was often hidden away and not spoken about. We have come a long way, and we still have a long way to go. The world moves very quickly for some people, and mental illness and mental health issues are often intergenerational as well. So it's something that they will inherit. It can even happen in utero. So while you are in that unborn space, if you're surrounded by a traumatic event like domestic family violence, or there's been an accident, all of those can impact the ability, the capacity of that infant to be able to cope as they're finding their way through, as they're growing and developing. And then it asks you to provide some examples of mental health myths. That means untruths, things that people say and brush that off rather than what it actually is. So there's 2 parts to that. But in this first one, there's actually 2 parts in there. Wherever you see a question where it goes, discuss the history and approach, it's asking you to break it down into history and then the approach. And then the next one will be providing examples around this. So there's 3 subheadings that I would put into that to know for yourself and also for your assessor that you fully understood the question. Otherwise, there may be gaps and it may be sent back to you. Great start, but there's elements missing. If you organise this in your document that you're building, you'll find that you'll be able to go back and a couple of paragraphs will give you your word count that you're looking for. So a paragraph is usually 150 to 200 words, just to give you a guide around that. So 3 paragraphs, that's 700 to 1200. You'll definitely be able to get that. You can put bullet points in, you can do your written, and then you can put your bullet points and then do where you got your information from. That will build it out as well. So you might have 5 or 6 different links that you went to that you thought, that's a really good site. I'll add that into my research project. So what was the prevalence of mental illness in Australia? And this is all statistics and data. Go to the Australian Bureau of Statistics, go to your state or territory health department, go to World Health Organization, and compare what's happening globally as well as locally. So what are some key issues people with mental health conditions experience? How does that impact their life, positively or negatively? And then what are some approaches to working with people with mental health conditions in a social context? Discuss the political context. So in that essence, they mean government makes law and the government determines where they're going to put public funds. So that's if you're going to be working in a non-government organisation, you're there because the government of the day has decided to fund that service. And a change of government can end and wrap up a funded program. Even if you think it's been successful, it could be where the drivers are for that political government. So we can't remove politics from any of the work that we do, because they are the administrators of public funds. And so we lobby and we share emerging trends, unmet needs, and we make sure that we have a voice, a collective voice. So there's peak bodies, like I said, Queensland Alliance of Mental Health. You may be able to think of some others in your state or territory. How does it impact people economically? It can pull them away from their work. The costs of people being admitted into mental health units, the costs of the services that are funded to support people. So this is data that we're going to expect for you to get. Don't get too carried away. You need to answer it all equally. Those 2 bullet points there, between 700 and 1,200 words, which is between 350 and that 600 words that you're looking at for both of those questions. And here it shows you at the end of each of them, or you may put that all of it in the very end, like it's got there just in one spot. It's here will show you how to reference something, what it's got to look like, and that's a great link, and we'll give you an example of being able to do that as well. Cool. So I'll stop sharing, and this is the end of our part 1. In part 2, we have the practitioner skills, some feedback, peer review, and some self-reflection. And then next week will be our final week on this unit, and we will cover a little bit more around what's the supporting documents that you actually need for these role plays. So you must do the role play before you can do the reflection. You must do the role play before you can write the client's case notes as well. I'll just give you an example of what one of those might look like for yourself. Okay, so here we have the document, which is in your portal, how home visit case notes template, and its code is SD. How to use this template. This is the one that you're looking for when you go into First Access, and your instructions show you. So you'll be filling in the first name, the family name, address, date of birth. We give you information. If you don't have all of that, then make sure that you put something in every area, so we can't leave that. So here it's asking you to do 1, 2, 3 progressive notes. So you will anticipate what each of those visits might bring in your session with that client. Definitely not wanting to leave. Sorry about that. That's just, it just paused a little bit on us. Let me just see if I can bring that back up again. I want you to be familiar with the documents that you'll be working with. So here we have Jacinta's form, which is one of the clients that we are working with here. Just open that up a little bit for us there. Hopefully get a slightly better view. Hope that's better. So the support plan is for Jacinta, who's 24. We work with youth 12 to 24, and we will often work earlier from 9 years of age, which is our early intervention prevention stage. And then, of course, we work beyond 24 up to 35, which is Gen Y, oftentimes our young parent cohort. So it's broad. But we also work with the family and friends of young people. The young person will always be the primary client. So in Jacinta's case, there are others. There's family members that she mentions because she had something happen, COVID turned up. The thing that happened to Jacinta was that her business started and then COVID came, and all of her hope and plans were built around the business being able to do the work that she loves, which she was a jewelry designer, and she had completed a degree in fine arts and had a lot of hope and enthusiasm. But during that time, she was impacted by events outside of her control. And so she wasn't able to continue her business in the markets and didn't have an income enough to be able to keep her own place. So she returned back to the family home, and feelings that she was experiencing are what is shared in this role play. So you'll play the role being the senior counsellor and providing referral services externally to others. There's a referral form, and when you talk to Jacinta about what might be a good program, then it could be something that you inquire about, perhaps her cultural connection around her faith. Now, we wouldn't do a referral plan out to that. We would just make an inquiry like a member of the public, and it may be that we provide the information and encourage Jacinta to explore that. So this is her support plan. So it's about creating a plan going forward, express her feelings and needs clearly to those who love her, and then check in fortnightly with Monica. So in the plan, you're writing down what you talk about, and then, of course, what you're going to be able to do. Apologise, it's your Tori Waller is the support worker in this case, but Monica is the senior counsellor. So you may refer internally, because what the type of grief that Jacinta is experiencing is grief and loss, and that's a particular type of counselling to be able to apply. So being non-judgmental support for Jacinta is what we aim for. That's the goals that we have, not today, but moving forward into the future. The agreed goals that you have might be that you look for a job related to Jacinta's interests and passions, something in the arts even could be explored, and then make an effort to communicate my needs and feelings to those around me, friends, and maybe parents. So this is what you and Jacinta will speak about in your role play session. You'll collaborate, you'll explore what might that be like. What would it look like if you were feeling like you were headed towards that goal that you first set? Tell me about what it was while you were studying and why you thought going this way. And do you have any of your jewelry? Are you wearing any of it? Or have you got any photos of it? Just have an interest, make a connection, and then be in that space safely before you can do any work. And some of those goals, you will write them down in that. So next week, we will see you for role plays if you're joining us. But right now, in part 2, after this one, you will see some of the learners who jumped in tonight and commenced their role plays for assessment in real time. So thanks, everyone. Stay tuned for part